Welcome to the Senate Doctor Show. I'm John Barrasso, an orthopedic surgeon from Casper, Wyoming. And it is a privilege to be here because in addition to being an orthopedic surgeon, I also have the privilege of representing the people of Wyoming in the United States Senate. And I am joined by Dr. and Senator Tom Coburn from Oklahoma.
Good afternoon, John.
Well, I'm delighted that you're here and going to be participating.
I'm glad to be participating with you.
You're still practicing medicine, still seeing patients, as well as serving as a senator.
I am.
And I haven't been in the operating room since last Wednesday. So we are both very, very patients, families across our states, but also we're engaged in this healthcare debate. And that's what this doctor show is all about. Senate doctors to talk about issues that affect you, to hear your questions, to listen to you, and to try to answer the questions, because this is probably the biggest debate in terms of most important in the history of the country in the last, 25, 50 years, maybe, Tom?
It's a debate that affects every American and personally will have an impact on their health care in the future.
Well, I mean, there is nothing more personal in our lives than our health care. And I take care of newborn babies that have problems with their hips, all the way to people, broken hips and grandmom, all the way to the last days. And you bring babies into the world.
I've delivered thousands of babies, care for the moms and the babies. And I'm an old-time country doc. I'm a family practitioner that does a lot of obstetrics and a lot of gynecology, and get a care for wonderful families all the way from babies to grandmoms.
So what we bring to this is a lifetime of experience in dealing with healthcare issues, but really in taking care of patients and trying to do what's best for them. And as we both see what's happening with this debate on Capitol Hill, we want to hear from you, try to answer your questions, and share with you the experience that we have in practice, as well as ways that we can improve the healthcare, because we do know that we need reform.
Well, there's no question about it. We also have some great ideas that we can solve a lot of the problems that most of the people that we talk to today have most concerns about when it comes to healthcare. And of course, the number one concern is it costs way too much. And you and I both know why. So as we go through this discussion and try to answer questions, our hope is that we can answer your question and that we can apply some common sense, some doctor common sense, that we can listen to our patients who tell us what's wrong with them, and that we can take the skills, the gray hair, the experience, and the training we have and apply that, not just to our patients, but to this problem that is so costly for the American people, but still so vital to every family that's out there.
And for folks, Tom, who want to get in touch with us, they can email us at doctors@src.senate.gov. We'd love to have an email from you. On Twitter at www.twitter.com/Senate_GOPS. Use the tag #SRHC, and I think you can see this on your screens right now. We're on Facebook at www.facebook.com/Republican Senators, or on YouTube at www.youtube.com/Republican Senators. So we'd love to hear from you, and we want to answer your questions.
Let me interrupt for a second. One of the things that a lot of times people think that we in Congress can't relate sometimes, and I thought I'd share a little of my medical history,
please,
because I think it gives me an advantage in looking at this healthcare problem. At 26 years of age, I was diagnosed with cancer. And actually, that's one of the reasons that led me to go into the field of medicine. And 6 years ago, I was diagnosed with cancer again. So I have had tremendous experience, not only as a physician, but as a patient. And I understand the patient side of this, through the surgery, through the radiation, through the chemotherapy that I've experienced twice in my life. Plus now I have a heart condition, so I'm getting to see a cardiologist, like many of the people that are watching this. So I understand the cost of drugs, I understand waiting in a doctor's office, and I understand the frustration that a lot of people out there. So I wanted our listeners and viewers to understand that it's not just that we come from a viewpoint of being physicians or a viewpoint of being senators. We've also both been patients, and so we know what it is to be on the other side trying to receive health care in this country.
And my wife, Bobby, is a breast cancer survivor. Fortunately, it's now been 6 years with 3 operations, 2 full rounds of chemotherapy, radiation therapy. So our family has seen it as well on both sides. And we know that we can improve things. We need to improve things in terms of the cost. And people are pretty happy with the quality of their care. But in rural Wyoming and Oklahoma, we need to make sure we have access as well. So there are things that we need to do. But I'm a big proponent of prevention. I think that's, for 25 years in Wyoming, I've been doing television health reports to give people information that they can use to stay healthy and keep down the cost of the care. I've been the medical director of what's called the Wyoming Health Fairs, where we do blood screening, about 60,000 blood tests a year, very low cost for diabetes, thyroid, the cholesterol level, PSA for men, the prostate test. And Medicare won't pay for them because Medicare doesn't think prevention is all that important. Or at least that's not the way they set up the system. So there are a lot of things that we need to improve.
I agree.
Well, I'll tell you, we have some people that have actually written in. We'll talk a little bit about that. But when we take a look at at what we're talking about for our Republican health care plans, Tom, as we were saying, we want to focus on health coverage for all 300 million Americans, including those that don't have insurance. And if we get down the cost, that's going to help many of those without insurance to have insurance. There are people that absolutely need help, and we need to help those people. But if we can lower the cost, that's going to help prevent so much of the cost shifting that occurs in healthcare. And then, of course, the plan is one that people can afford. And that's the big key to this. There's anxiety all across the country. And even if I have insurance, what's it going to cost next year?
Right. And the worry that comes in. The other thing that we have been planning and want to make sure that we accomplish in this is nobody should ever have to file bankruptcy because of a healthcare problem. Nobody should ever lose their home because of a healthcare problem. Everybody should know pretty much in advance what they're facing in terms of costs. So that's called transparency in terms of price. But they also ought to be able to get transparency in terms of quality outcomes. And so our hope is when we combine all that together, that we can accomplish what the American people want us to do. Increase the access, lower the cost, emphasize prevention and management of chronic disease. 5 diseases consume 75% of the money we spend on healthcare in our country. And if we can incentivize the management of those chronic diseases and prevent others who don't have those diseases from getting them, then we can markedly lower everybody's healthcare costs in this country. And so prevention, maintenance and control of chronic disease and prevention and wellness has to be the biggest component of anything we do, and we have to start emphasizing that. Grandma's right, an ounce of prevention is worth a pound of cure.
And I've been telling people in Wyoming for years, half of all the money we spend on healthcare is on just 5% of the people. Yeah. And those are people that tend to eat too much, exercise too little, and smoke. So we talk about these preventables. Those are the folks that develop high blood pressure, diabetes, heart disease, cancer, and the incentives, I think, have to be individual incentives, because I think people are real smart about how they use their own money, but probably don't focus as much if they're spending government money or
somebody else's money.
Yeah. So I see that in my practice. I know you did as well. But I think we need to do with individual incentives. When I read the Kennedy bill and see that what he wants to do is say, well, we'll put money in for sidewalks and street lamps and jungle gyms. That's well and good, but that's not going to make somebody actually want to go out and try to lose weight because they're going to save money themselves.
Actually, Safeway, a lot of people know who Safeway is. Safeway's healthcare costs have risen less than 0.5% over the last 4 years, whereas their competitors' costs have risen 42%. And the difference has been that they have emphasized prevention. They've actually incentivized their employees through money to participate in activities that are prevention related, and they've gotten tremendous results.
And I think if they get their blood sugar down, they get their cholesterol down, they lose weight, they kick the tobacco habit, all of those things actually mean money in the pocket of that worker, as opposed to just a savings to a system.
Also, quality life and a longer life.
Because it's personal, and it's about their own health. Yeah. And the healthier we can keep people, the better it is for everybody else. Well, I know that we have a question that we had a video camera out on the mall, and the first question is coming in now from Virginia.
I'm at a point that I've just retired, so, I want to know what they're going to do for retirees to keep health care down to a minimum, something that we can afford and still get the good benefits from it. Basically, that's, right now my concern, especially people on a fixed income and with rising costs of health care, and prescriptions are getting out of hand. So what are they going to do to help the issue with prescriptions?
Well, that's Joyce from Virginia, and she raises a couple of interesting points, because you look at her, she doesn't look like she's a Medicare age yet. She's retired, which talks about somebody who has to go out and buy their own health insurance. And what we want to make sure is that anybody that buys their own health insurance gets the same tax benefit that they might have gotten if they got their insurance through work. And we don't have that right now. If you buy your own insurance, it's a challenge because it actually, in terms of the dollars out of your pocket, it's higher because you don't get the tax break as opposed to if you got your insurance.
Well, it's a real dollar difference. It averages about $2,700 if you're employed getting insurance. That's the tax benefit. If you're like this lady, she gets about $100 worth of tax. So that ought to be equal. We ought to make sure everybody in the country is treated equally with regard to the tax benefit of buying their insurance.
And for somebody like her, I look at that and say, why can't she shop across state lines to buy insurance? Why can't she really shop around instead of being limited to where she happens to live? You know, as somebody said, you can buy your car insurance from a lizard. Why can't you go buy your health insurance and shop around and make some decisions and keep the price down that way?
Actually, and we know that works.
Yeah.
We know that, in fact, if we have increased competition in the insurance industry and more choice by the patient about what is best for them, not a bureaucracy saying, here's what you must buy, but me as an individual saying, here's what I want to buy, that in fact we can lower the cost significantly for people.
And she also asked about medication. You know, we have all of these the direct-to-consumer advertisements, and you know, they come to your office and say, you know, I saw a commercial and it said, you know, ask your doctor if the such and such colored pill is right for you. I mean, I think there are people coming in asking for pills that are expensive, but there are cheaper pills that are just as effective.
Absolutely, absolutely. And again, because we don't pay for prevention, and what we tend to do is address the only single complaint that's there that time at the office, rather than saying, I can take the time and really talk about the issues, not just this one issue, but the other health concern. You see somebody that's overweight, you can address that. But the way our dynamic and our payment system is today, doctors are not incentivized to do that because they, quite frankly, won't get paid for it.
Medicare has its, 7,500 codes, and you know, if you do something to the patient, and you write the code in, then the government sends you the money. Right. But that is so focused on sickness as opposed to health. You get nothing.
That's right.
You know, if the patient calls and you call them back on the phone, they don't count that as doing anything for that person, and you may have actually made a big difference in that person's life. I think they have it all upside down, Tom.
I agree. The other things that we ought to talk about is some of the other principles that we think are important in healthcare. And the first principle is to not allow anybody to get between you and your choice of physician, or you and your physician about you all discussing what is right for you. In other words, the individual patient, with the help of his or her doctor, making the right decisions based on what their situation is, not what a book says. Somebody that has actually got their hand on you, that's felt you, that has listened to you, that has examined you, that knows. Those people making the decisions about your care, rather than a bureaucrat, rather than somebody from the government making a decision because it looks right in terms of the tables, but hasn't ever looked you in the eye and know what is going on. And this really goes to a point, John. We can practice medicine that way, and we'll have far worse outcomes. What we are ignoring is the art of medicine. And the art of medicine is not 100% science. A lot of it is art. And as you get gray hair like I do, and you'll have soon, with that amount of time of experience, those things go together to give us judgment that doesn't fit the book. It fits the patient. And that's what healthcare is all about. And so one of our principles is to make sure nobody gets in between the patient and the doctor and the decisions that are made for that patient's best welfare.
And that shouldn't be a government bureaucrat, shouldn't be an insurance bureaucrat, nobody.
That's right.
And that's what you and I both fought for, practicing medicine. So it is interesting as we work toward this and try to find solutions that work best for our patients. I have concerns. I want to have up this system of comparative effectiveness, and I know you've been working on that on the HELP committee.
I have.
My concern is that there's going to be somebody with a book and is going to tell you what you have to do or can't do to that patient when you know better.
I think there's an important point. Most Americans on Medicare don't realize it, but today Medicare is already starting to do that. And they're starting to do it not because it's good medicine, it's because it saves them money. And I'll give you an example. Is you can have a video colonoscopy where you swallow a little tablet that has a camera in it, and that's more expensive. But we have a lot of seniors where the risk of a flexible colonoscopy is dangerous for them,
could
highly
perforate.
dangerous.
Could
Yeah, right, it can, but it also just giving them the
The
sedative,
anesthetic?
the deep sedation that's required to do that is risky for them. Well, Medicare has decided that you can't do that if you're a Medicare patient. And so consequently, we're putting people at higher risk
They don't have anything.
to do a screening because they can't have a test that's less invasive, even though it costs more. So judgment is a key component on that. Doctors will do a good job on cost if we're given a free hand to do what's in the best interest of the patient.
I think we had an email coming in.
We do, and let's see, this is from Elizabeth in North Carolina.
President Obama says, I'll still be able to keep my health insurance if Congress passes a government-run health plan. She asks, is that true? I want to make sure that I can keep my health plan and be able to go to the doctors I choose.
Well, I know that's a stated goal of President Obama, but the Congressional Budget Office says that isn't true. Says that under the plan as written today, 16 million American families will lose the insurance they have today. As being somebody that's writing and working on that bill, offering amendments, I think that's a very low number. I think it'll be significantly higher than that because there will be an incentive for your employer to quit offering you care so that you can in fact participate in a government program. And so the economic incentives of that will be that your employer may give you $3,000 or $4,000 more in wages, but you may lose in terms of the benefit that you were given, and then you go and get the government-run plan.
And you know, it's interesting, people in Capitol Hill now are looking at things around the world. They look at Australia, and they have a government-run plan in Australia. It is cheaper, but you get less. You know, in the Australian government-run plan, you know, instead of going to a private room in the hospital, you're in a ward, like it was when you and I were in medical school, 4 or 6 patients in a ward. They take care of catastrophic coverage, but you know, for elective procedures, you know, you wait in line because you've paid less, whereas opposed if you paid for the private plan, a higher fee, then you go to the front of the line. So it's interesting as we try to find the best solutions.
There's two sides of that.
Yeah.
Our approach has been, let's do both. Let's gain efficiency, but let's not limit access, and let's hold people accountable in a way that market forces will lower some costs, but let's make it transparent. Having a bureaucrat say what you can and can't have, combined with no control on the costs, will never control the costs. And so what we need is the power of the individual with some connection to skin in their pocket, skin in the game, saying what's best for me and does my physician think is best for me, and can I do that in a way and still have an outcome that's feasible? You know, that's one of the things Safeway found. They looked around their headquarters for a price differential. They found a 10 times price differential for the same procedure within 5 miles of their corporate headquarters. So one of the things is, and that's equal quality, equal outcomes. One of the things we want to do is to give people the ability to choose, not just based on quality, but on transparency of the price, so that they may be able to buy it at a lower price and they benefit from it. And we all benefit from that if we allow those competitive forces to work. So the answer to Elizabeth's question is most people can, but 16 million American families, a significant portion of those that are insured, well over 10%, will lose their private insurance.
That was the big concern I had when they first did this, you know, look at the one bill, the Kennedy bill, that had to do with, you know, what's it going to cost and how many people is it going to help, and are they going to cover all the people that don't have insurance, and is it going to let people keep their insurance? And the numbers came out that it was going to cost over $1 trillion. $1 trillion, I mean, that's an astonishing amount of money. And over $1 trillion, and it was only going to cover about 16 million of those 47 million who aren't insured, plus it was going to knock a bunch of people that were on regular insurance off of that.
That only covers them for 6 years.
That's
a 6-year cost, not a 10-year cost.
So the costs get very high. And some of this costs now are going to get pushed onto the states. And I was home over the 4th of July talking to my governor. He said, it'll crush us if they try to push this onto the states. And they're not going to push it on day one, but it'll get there pretty soon.
They're pushing it on day 4.
Yeah.
And the reason they're doing that is a technical reason, but it means the bill won't score. What is told us we're going to cost $500 billion, it's actually going to cost $1.2 trillion for that portion only. So we're at about $2.4 trillion right now in the cost of this health care bill.
Also, we don't want to make it harder for small businesses of America, for American business owners who are already, trying to provide insurance. We don't want to add to their cost, and I know you have some ideas.
Plus, we also want them to be able to be competitive.
Yeah, they're going to have to compete against other places around the world. Well, we have a second question coming in from Carrie from Missouri. Let's take a look and see what Carrie has to say.
How can healthcare reform be successful and also not affect small business owners too adversely? I realize it's a big job, but there's a lot more small business owners out there than there are big business. So, I just think that's going to be something to be really important to try to balance those two equations.
Well, that's Carrie's right, and certainly for Oklahoma as well as Wyoming and a lot of places around the country. Small businesses is what drives our economy. That's the engine that helps create the jobs. When we have an economic situation waiting to create more jobs, they're starting in small businesses. And everything we can do to make it easier on small businesses. My colleague from Wyoming, Mike Enzi, has this 10-point plan for improving health care, and part of it is allowing small businesses to get together to competitively work to get down insurance rates, because if you have some more competition, that's terrific. And we want more choices for people, give them opportunities to make choices and get the care down and the cost down, because we don't want to hurt our small businesses, as you say, when they try to compete. So she's very smart, I think, to focus on small business owners, and that's what I hear when I travel around Wyoming.
Yeah, and 7 out of every 10 new jobs that are created in this country come from small business. And the plan that is before the Senate today, 50% of the cost, the increased tax cost of this bill, is going to come from small business. Yeah. So it is tremendous burden on the job-creating segment of our economy, which ought not to be that way.
The other thing I worry about in terms of the small business is you hear this incredible amount of debt that we as a nation are taking on, and whether it was the stimulus package that, to me, spent too much and borrowed too much, and these takeovers, and now it looks like an attempted takeover of all of healthcare, and these expenses of $1 trillion. When I go to high schools and talk to kids, and they say, well, who's going to pay for this? Or I ask them who's going to pay for it. They know. They point to themselves. They said, we are. And that's not fair for us to do for our kids and our grandkids. We need to be responsible, live within our means. And I just think if we can't get this cost under control, it's going to bankrupt.
And there are plans out that we've put out that don't raise taxes at all and cover everybody in this country, and do so with a plan that's equivalent to a private quality plan, where you still get to make the choice, you still make the decisions about your health care. A government bureaucrat doesn't get, and it drives down the cost. I believe we have another question.
I know emails are going to continue to come in. If people want to contact us, all you need to do is email us at doctors@src.senate.gov, or on Twitter, on Facebook, on YouTube, and we're going to do this every Tuesday and every Thursday and talk about the bills that are in front of us in the House and the Senate. But I got it
for a while.
For a while.
Not every Tuesday and every Thursday.
Well, I'm going to stick it out until this is resolved. But the thing that has always bothered me, I've only been here in the Senate 2 years, is that it seems that people don't get a chance as elected officials, but the folks at home, to read the bills. And yesterday, somebody asked Democrat leader Hoyer, and they said, are you going to make sure all the members of the House read this bill before they vote? And he laughed. There was a press conference, and he laughed at the question, laughed at the idea that House members would actually read the bill before they vote on it. And I'm astonished by that. I was offended with the stimulus package bill, that 1,200 pages, it hit the desk in the middle of the night, and they had to vote that same day. I went to the floor of the Senate and said, let's have everybody take that bill home, read it, because it was the last day right before the Washington, the President's Day week-long work period, where you go home and visit with people around the Senate. I said, let them take it home and read it and visit with people and have town hall meetings and then come back and vote. No, they forced the vote before people got home to hear how much opposition there was to that across the country. Next was this cap and trade bill right before the 4th of July. Before they let them go home, the leadership, Nancy Pelosi in the House, said, nobody's leaving until we vote. And they dropped 300 pages into the bill at 3 in the morning and voted on it later that day. And now for the leader in the House to laugh when they say, nobody's going to read the bill. I have people in Wyoming who want to read this bill. I want to read this bill. I know you want to read this bill. people of America, if you're going to affect every person's life, as you said, every person, healthcare is a very personal thing. You're going to affect the lives of every American. The American people have a right to read this bill. And when I heard today that they say, no, we want to get this voted on before you go home to have your town hall meetings in August, I said, that's irresponsible. Anybody that would vote for this without having a chance to read it and share it with the people.
the House health care bill.
The House health care bill.
Right.
But as we work our way through this, which is what this is all about, is trying to find a way to let Americans have the good ideas from all across the country. Washington doesn't have all the good ideas. I'm not sure
Actually,
that
they don't have very many good ideas. Most of the good ideas come from outside of Washington.
They come from home.
You bet.
So I think that that's what we need to do. And you're watching this. You want to read the bill, call your representative, call your senator, tell people you want to read the bill, that they shouldn't vote until people have a chance to read the bill.
I think the other thing we should leave them with is, as physicians, we know about healthcare. We care about people. We're not going to make a decision that benefits big business over the expense of individuals' free choice and access to healthcare. We do really want everybody in this country to have healthcare. We want it to be equal and accessible and understandable, and we don't want to saddle our children with years and years of lower standard of living because we haven't done a good job on this. And so our commitment to you all is that we're going to work hard to make sure it doesn't cost a whole lot, but we get the great benefits that can come out of this.
And for 25 years, I did health reports in Wyoming, giving people information they could use to stay healthy, to keep down the cost of the care. And I signed off every health report saying, here in Wyoming, I'm Dr. John Barrasso, helping you care for yourself. It's about giving people information they can use, they can stay healthy.
And push away from that dessert tonight.
Well, thanks for being with us. We are going to be back next Tuesday, same time, to talk about the issues, what's happening. Dr. Coburn,
Good to see you, John.
Privilege. Thank you
Dr.
very much.
Barrasso.
Thank you for being with us today.